Time to visit Dr. Kevin Kavanagh. He is a retired physician and also the founder and president of Health Watch USA. Good morning, Doctor.
Good morning, Jack.
You have a good weekend?
Very good, very good.
All right, let's see. Where do we start this morning? What's in the news regarding? Why don't we start with the good news about the vaccines that are on the horizon?
Well, yes, there's a lot of good news there. AstraZeneca, Oxford, their vaccine looks like it is 70% effective, and it will be coming out very soon. The big advantage of this vaccine is it does not have to be kept in ultra cold storage. In other words, it can just be approximately 2 degrees Celsius, which will be your refrigerator. It'll be great. And that's going to allow you to get this vaccine into remote areas. And this is a big problem around the world. The vaccine, which we're probably going to be using, the Pfizer or the other types of vaccines that have this RNA type of technology, those have to be kept ultra cold, and they're not really good for distribution out in the very remote rural areas, or for example, in Africa or some remote countries. And this will allow the whole world to start to get vaccinated. And so that's huge, because remember, this virus doesn't respect borders. It does little good to have us get vaccinated, viral levels get really low. Several years later, this virus comes then back from another country where it's running rampant in its population. Johnson & Johnson also has announced a vaccine which will only require a single dosage. That again will be another huge breakthrough. And Regeneron, they just received FDA approval for their antibody cocktail, which is comprised of 2 monoclonal antibodies. It should have equal efficacy, but with 2 monoclonal antibodies, there'll be less chance for resistance, and it should be a great advance forward. Now, on the downside of that, and this is the cautionary note, there's only going to be 200,000 doses available by the end of the year, which is why we really do need to follow public health advice and drive these rates of coronavirus downward.
All right. Now, I read this morning online that the average person, not a frontline worker or sick and elderly and all that, just the regular folks out there will probably be able to get the vaccine in April. And so we still have a ways to go. But I'm trying to think, well, when you go to get, say it is April, when you go to get your vaccine, are you going to have a choice since there are so many different vaccines that are vying to be approved? If there are 2 or 3 approved, how's that going to work?
I have no idea, Jack. We're just going to have to wait and see. I would imagine your physician is going to choose the type of vaccine he'll be distributing. I don't think he'll distribute more than one. And because of that, if you go to a certain physician, that's going to be the vaccine that you will receive. Now, I'm saying that more out of concern for safety, because many of these vaccines require 2 doses. And you have to make sure that the second dose is the same vaccine as the first dose. And so people are going to get a card, etc. So I do believe they may be site specific as to the type of vaccine you receive.
Okay. Of course, we've got Thanksgiving coming up, and I'm reading a lot of folks saying that they're going to throw caution to the wind, and they're going to have a big to-do. And I don't know if there's anything that we can say or do to prevent them from doing that, but just think twice about it before you have a whole bunch of people over and wear masks and do all the standard stuff that we all know we should be doing.
Well, definitely. You need to take precautions, and I need to underscore the fact that masks are not nearly 100% protective. There's a recent study out in the Annals of Internal Medicine that really underlines the points I think that we were discussing on Friday, that masks in the laboratory, they work great, but if you go out and you have bad behavior, you're not following good advice. In other words, wearing the mask is giving you a false sense of security, so you take more risks and have risky behavior. The coronavirus spread may go up, or it may not go down nearly as enough. So mask is a layer of protection. Please wear a mask plus social distance. It's hard to have Thanksgiving dinner if you're doing both of those. To me, I think it's a bad idea. Have 2 Thanksgivings next year, Believe me, with my COVID pounds, I don't need a turkey around my stomach line.
And that goes for most of us. Hey, we appreciate it very much, and we will talk to you again on Wednesday. Thank you.
Thank you very much, Jack.